I'd dried bedpans for 6 months without complaint. The attending physicians called me the quiet one, the nervous one, the one who shouldn't be handling trauma cases. They didn't know. Then a decorated colonel came into our ER after a routine surgery at Walter Reed. Post-op infection, they said, standard transfer. Except his vitals were crashing. Sepsis, the lead surgeon announced, already writing orders. But I'd seen this before. Different hospital, different country, different war. My hands moved to his chest, there, barely visible on the scan they'd all dismissed. "That's not infection," I said quietly. The room went silent. "That's a bullet fragment, and it's moving toward his heart." The surgeon's face went white. They had 12 hours before it killed him. I had 12 minutes to explain how I knew. The room erupted. Dr. Whitmore spun from the monitor, his face flushed red beneath the harsh fluorescent lights. "You've been here 6 months. I've been doing this for 20 years. Around us, the emergency room staff froze. Nurses mid-step, residents clutching clipboards, everyone suddenly fascinated by their shoes. I stood my ground, pointed at the CT scan still glowing on the screen. "Right there. See it?" Whitmore leaned closer, squinting. His jaw tightened. "I see normal post-operative imaging. Some inflammation. Fluid collection consistent with infection." He straightened, crossing his arms. "What I don't see is a first-year nurse contradicting a surgical diagnosis." The other nurses exchanged glances. The nervous one was speaking out of turn again, overstepping, making everyone uncomfortable. But I'd seen this before. Different hospital, different country, different war. My finger traced the scan, following the shadow they'd all dismissed. "That's not fluid. Look at the density, the irregular borders. That's metallic." Whitmore's eyes narrowed. "You're suggesting Walter Reed's entire surgical team missed a foreign object?" "I'm not suggesting. I'm telling you. That's a bullet fragment, and it's moving." "Call radiology," someone muttered. Whitmore waved them off, but the resident was already dialing. Dr. Patel arrived 3 minutes later, tablet in hand, irritation written across his features. "This better be important. I have 6 other consults." Whitmore gestured at the monitor. "Our nurse here thinks she's found something we all missed." Patel's expression said everything. Another false alarm, another waste of time. He pulled up the imaging, fingers swiping through sequences with practiced boredom. Then he stopped. His finger hovered over the screen. Zoomed in, enhanced contrast, adjusted density parameters. "There's something there." The room went silent. Patel's voice lost its edge. "It's small, 5.7 millimeters, fragmented hollow point from the density signature." He looked up, confusion replacing irritation. "How did none of us catch this?" "Because you weren't looking for it," I said quietly. Whitmore moved closer to the screen, his face pale now. "Where exactly is it lodged?" "Near the pericardium, close to the cardiac wall." I pulled up another view, highlighting the position. "And it's not stationary. See these sequential scans from Walter Reed? It's migrated 0.3 millimeters since yesterday. That's impossible. It's happening. Every heartbeat is moving it closer to penetrating the heart wall. The fragment is caught in fibrous tissue from the original injury, but that tissue is degrading. Once it breaks free..." Whitmore's hand went to his mouth. "How long?" "Hours, maybe less." The monitors beeped steadily behind us. The colonel's vital signs holding stable for now, but I could see it in my mind, the fragment shifting, millimeter by millimeter, working its way toward catastrophe. "We need a surgical plan," Patel said. "This requires immediate intervention." I was already calculating. "Median sternotomy with cardiopulmonary bypass standby. You'll need to access between the 4th and 5th rib. Careful with the internal mammary artery. The fragment's embedded in scar tissue, old wound, military-grade ammunition." Every face in the room turned toward me. The words had come automatically, precise, clinical, the language I'd spent 6 months trying to forget. Whitmore stared. "How do you know that?" I didn't answer. Couldn't. My hands were steady, but my chest felt tight. The resident spoke up, voice uncertain. "Should we transfer him to cardiothoracic?" "No time." I kept my eyes on the scan. "The fragment's position is too unstable. Any movement could dislodge it. Transport alone could kill him." "Then what do you suggest?" Whitmore's voice had changed, no longer dismissive. Something else? Curiosity? Maybe respect? You operate here, now. Get your best cardiothoracic surgeon, set up for emergency thoracotomy, have massive transfusion protocol ready. The staff remained frozen, looking between Whitmore and me. "Who are you?" he asked softly. Behind us, someone gasped. The colonel was awake. His eyes found mine immediately. Gray eyes, sharp despite the pain medication. He studied my face, my posture, the way I held myself. "You've done this before," he whispered. The room held its breath. "Combat theater?" I said nothing, but he saw the answer in my silence. He nodded slowly, understanding passing between us. "Then you know what happens if they miss." His eyes closed again, but his hand moved slightly. A gesture. Trust. The ER doors burst open, hospital administrator, gray suit, tablet clutched in white knuckles, two people in dark suits flanking her, Pentagon liaison badges visible even from across the room. "What's going on here?" The administrator's voice cut through the tension. "I have the Pentagon calling. Walter Reed is demanding answers," she pointed at me. "How did a first-year nurse diagnose what their entire surgical team missed?" Whitmore stepped forward. His voice was steady now, certain. "Because she's not just a nurse." The administrator's eyes narrowed. "Then what is she?" Everyone waited. I looked at the colonel on the gurney, at the monitor showing the fragment, at the clock on the wall. "Get him to surgery. Then I'll explain everything. But first, he lives." The administrator opened her mouth to argue. I cut her off, my voice harder than it had been in 6 months. "You can fire me after. You can report me. You can do whatever you want. But right now, that man has a bullet fragment migrating toward his heart, and you're wasting time I don't have." Whitmore nodded. "She's right. Or 3. Now." The staff moved, protocols activated, surgical team paged, equipment prepped. The administrator stayed planted, staring at me. "Who are you really?" I met her gaze. They didn't know. They couldn't know. I wasn't always checking bedpans. The words hung in the air as they wheeled the colonel toward surgery. His eyes found mine one more time as they passed, a look of recognition, of knowing. He'd seen combat surgeons before. He knew exactly what I was, and in 2 hours everyone else would too. My hands were already moving through the motions, muscle memory I'd tried to bury. But you can't kill training that's written into your bones. The doors swung closed behind the gurney. Whitmore paused beside me. "Whatever you are, whoever you were." He looked back at the CT scan still glowing on the monitor. "I'm glad you're here today." I nodded once, but inside, my mind was already elsewhere. Already in that operating room, already seeing the procedure step by step. 5.7 millimeter fragment, hollow point, fragmented on impact. I'd extracted 47 of them before, 47 successes, and 1 failure that cost me everything. The administrator was still talking, still demanding answers, but I was already scrubbing in mentally, already feeling the weight of the scalpel, already hearing the monitor's rhythm. Because in 2 hours, everyone would know the truth. The quiet nurse, the nervous one. She died 6 months ago in Kandahar. And what walked into this hospital was something else entirely, something I'd tried to leave behind, something that wouldn't stay buried, not when lives were on the line. Not today. 247 hours. The surgical theater was cold, sterile, nothing like the dust and heat of Kandahar, but my hands remembered anyway. I stood at the scrub sink, water cascading over my forearms, methodical, precise, the same motions I'd performed 1,000 times before. Whitmore had insisted. "You're assisting whether the board likes it or not." His voice had been firm, brooking no argument from the administrator still making calls in the hallway. Through the glass, I could see them prepping the colonel, draping, monitors connecting, the rhythmic beep of his heart rate steady for now. For now. The betadine turned my skin orange. I scrubbed harder, watching the suds form and disappear down the drain. 5 years ago, I'd stood at a sink just like this one. Different continent, different war, same hands, forward surgical team, Kandahar province. The youngest surgeon ever appointed to a special operations medical unit. They'd called it an honor, a distinction. I'd called it Tuesday. Level 1 trauma, Mass casualty protocols, field transfusions with whatever blood we could find. I'd performed 12 thoracotomies in a single 18-hour shift once, 47 successful field surgeries under direct fire over 2 years. 47, the number used to make me proud. Now it just reminded me of 48. I rinsed. The water ran clear. But my mind was somewhere else, somewhere darker. 6 months ago, the convoy ambush happened at dawn. We'd been operating for 16 hours straight when they brought him in. Lieutenant James Rivera, 27 years old. Entry wound through his lower back, fragments scattered through his thoracic cavity. I'd found the primary fragment, 5.8 millimeters, hollow point, lodged near his heart, just like the colonel's. I'd begun extraction, careful, methodical, 3 minutes from success. Then the mortars hit. The field hospital shook, lights flickered, someone screamed, power failed, and in the darkness I felt his pulse stop under my hands. By the time backup generators kicked in, he was gone. The fragment had shifted during the explosion, puncturing his cardiac wall. Massive hemorrhage. No chance. 3 minutes. I could still feel it. The exact moment his heart stopped beating against my fingertips, the warmth of his blood, the weight of failure. I'd turned in my resignation that night, couldn't trust my hands anymore, couldn't trust myself. Every patient became Rivera, every crisis became that convoy, every monitor beep became the sound of mortars falling. So I ran. Took the lowest position I could find. First-year nurse, bedpans and vital checks, nothing that required decisions, nothing that could go wrong, nothing that could kill anyone. The scrub timer beeped. 5 minutes, done. I pushed through the OR doors, hands raised, dripping. The nurse helped me into gloves, gown, the familiar weight settling over my shoulders. Whitmore was already at the table, the colonel's chest exposed, prepped, waiting. "How do you want to approach this?" Whitmore asked. I moved closer, studied the imaging on the display screen. My breath caught. 3 fragments, not 1, 3. The primary piece we'd identified, yes, but 2 smaller fragments flanking it, 1.2 and 1.4 millimeters, barely visible on the scan. Easy to miss if you weren't looking. Walter Reed had missed them entirely. All 3 were moving, independently, working their way through degrading scar tissue toward his heart. This wasn't similar to Rivera's case. It was worse. Whitmore saw my expression. His voice dropped. "What is it?" 3 fragments. I pointed at the screen. All mobile. The primary piece has maybe 20 minutes before it penetrates the cardiac wall. The smaller ones are closer. They'll go first. His face went pale. "I can't do this. The approach is too complex." He looked at me, his eyes holding something I hadn't seen before. Belief. "But you can." My hands started trembling. First time since that night in Kandahar? Not again, not this time. The anesthesiologist looked up from his monitors. "Former Navy," his badge said. He'd been quiet until now, but his eyes studied me with sudden recognition. "Your FST." I didn't answer. "I've heard stories. There was a surgeon in Kandahar, youngest, most skilled. They called her. That person doesn't exist anymore." My voice was flat, dead. He met my gaze across the table. "She does today. That colonel needs her." The monitors beeped, steady rhythm, the sound of a life continuing, for now. I looked down at my hands, still trembling, still remembering Rivera's pulse fading under my fingertips. But beneath the tremor, something else. Muscle memory. Training burned so deep it couldn't be forgotten, only buried. The colonel's vitals flickered, heart rate increasing, blood pressure dropping slightly. The fragments were moving faster. Whitmore stepped back. "Your call." I closed my eyes, breathed, felt the weight of the moment pressing down. Rivera died because I froze, because the mortars hit and I lost focus for 3 seconds. 3 seconds was all it took, but this wasn't Kandahar. No mortars, no dust, no darkness, just me. This patient. And the training I'd tried to kill. My hands stopped trembling. Scalpel. The word came out different than it had in 6 months. Not hesitant, not quiet, authoritative, commanding, absolute. The nurse placed the instrument in my palm. The weight familiar. Perfect. I positioned the blade over the colonel's sternum. The room held its breath. First incision. Clean. Precise. Following the line I'd visualized 100 times in my mind. Blood welled. Suction cleared it. Retractors spread the tissue. Then I saw it. No. The primary fragment had already punctured the pericardial sac. Blood was pooling in the cardiac cavity, faster than predicted. The timeline had just collapsed, 15 minutes, maybe less. Whitmore swore softly. This is where Rivera died. The thought came unbidden. This exact moment, when everything went wrong and there was no time left. But Rivera didn't have a choice. I did. Get me cardiopulmonary bypass. My voice cut through the tension. Now, we're going deeper. Whitmore's eyes widened. If we go on bypass, if we don't, he dies in 10 minutes. I looked up, meeting his gaze. Your choice. He nodded once. Bypass. Prep it. The team moved. Fast. Efficient. I looked back down at the colonel's chest, at the blood pooling around his heart, at the fragment still migrating toward catastrophe. My hands were steady now. The person who dried bedpans was gone. The surgeon from Kandahar was back. And this time, I wasn't going to freeze. This time, I was going to finish what I started. Monitor alarm, heart rate spiking. Whitmore looked at me. Ready? I adjusted my grip on the scalpel. Ready. The fragments were moving. Time was running out. The colonel's life hung in the balance. But my hands remembered. And muscle memory doesn't forget. Even when you wish it would, even when you've spent 6 months trying to kill it, it just waits, buried, patient, until the moment you need it most. And that moment was now. I made the second incision, deeper this time, through pericardium, into the cardiac cavity, blood everywhere, suction working overtime. There. First fragment, smaller one, 0.2 millimeters from penetrating the ventricular wall. Got you. Forceps, steady pressure, gentle extraction, 1 down, 2 to go. And the clock was ticking. 23:14 hours. I'd taken full surgical lead. Whitmore had stepped back without argument, watching my hands move with the certainty of someone who'd done this 1,000 times before. Because I had. Retractor. My voice was steady, clear, no hesitation. The instrument appeared in my palm. I positioned it. Perfect angle, perfect pressure, suction, blood cleared, the field visible now. Pericardial sac open, heart exposed, beating steadily despite everything. Clamped the left anterior descending. Whitmore moved precisely where I directed, his hands following my commands without question. The dynamic had shifted completely. He wasn't the attending anymore. I was. My fingers traced the pericardium, feeling for irregularities. The tissue told stories if you knew how to listen. Scar tissue here, old trauma, military injury patterns I'd seen dozens of times. There. First fragment, embedded deep in fibrous tissue from the original wound. 0.2 millimeters from the ventricular wall, microsurgical forceps. The nurse handed them over. Delicate instruments, precise. I slipped them into position. Steady pressure, no rushing. The fragment was caught in scar tissue, adhered by months of healing. I rotated counterclockwise, gentle, patient. The tissue released, fragment extracted, 1.2 millimeters, hollow point tip. I dropped it in the specimen tray with a metallic clink. 1 down, 2 to go. The monitors beeped steadily, heart rate stable, blood pressure holding. But I could see the second fragment on the imaging. And my stomach dropped. It had migrated into the heart wall itself, lodged between cardiac muscle fibers, deep, dangerous. Standard extraction would cause massive hemorrhage, uncontrollable bleeding, death in minutes. The OR went silent, everyone seeing what I was seeing. Whitmore's voice was quiet. We need to close up. Transfer him to cardiac specialists at Johns Hopkins. They have the equipment for this. He'll die in transport. I didn't look up, kept my focus on the exposed heart. I can reach it. The silence deepened. Doubt hung in the air like smoke. I've extracted shrapnel from beating hearts before. My hands moved, preparing instruments, blunt dissection, following tissue planes, controlled micropuncture technique. I developed this method in field conditions. When? The anesthesiologist asked softly. Twice in Kandahar, once in Kabul. Always. Successful. Numbers, specifics, the language of credibility. Above us in the observation gallery, I sensed movement, didn't know who, didn't care. My world had narrowed to this patient, this heart, this moment. Show me. Whitmore stepped closer. I positioned the microdissector. The technique required feeling more than seeing. You can't force your way through cardiac muscle. You have to follow the natural tissue planes, find the paths of least resistance. Let the heart guide you. My hands moved, steady, precise, each motion calculated. The fragment was visible now, barely, a dark shadow between red muscle fibers. In the gallery, the administrator stood with her phone pressed to her ear. Her face had gone pale. Beside her, a man in a dark suit. Pentagon liaison badge visible even from here. His voice carried through the intercom. "That's Captain Morgan Reeves. She disappeared 6 months ago after the Kandahar incident. She's the most decorated combat surgeon in special operations history." The administrator's expression transformed. Shock, disbelief, recognition. The nervous rookie, the one who shouldn't be in trauma cases, military legend. She has no business in that OR, her own words from 2 hours ago. Now she stood frozen, watching through the glass. Whitmore spoke without looking away from the surgical field. "She's the best I've ever seen." Even the senior staff had stopped moving, mesmerized, watching something they'd never witnessed before. I slipped the microforceps between muscle fibers, delicate, careful. The heart continued beating, steady and strong, trusting me not to fail. The monitor showed the rhythm, unwavering, perfect, gentle pressure, millimeter by millimeter, following the path I'd visualized, the fragment shifting, moving, coming free. There, the fragment released, blood flow normal, no hemorrhage, clean extraction. I placed it in the tray, 1.4 millimeters, second fragment secured, 2 down, 1 to go. But the third fragment was the worst, lodged against the coronary artery. The imaging showed it clearly. One wrong move and the artery would rupture. Instant fatal hemorrhage, no coming back. 5 minutes of remaining bypass time before we'd risk cardiac damage. Morgan. Whitmore's voice held something I'd never heard before. Fear. "Captain, we can't risk this. If that artery ruptures..." His name is Colonel William Chen. I kept my eyes on the fragment. Father of 3. Served 4 tours protecting people like us. The room held its breath. I let Rivera die because I gave up. My voice was steady despite the weight of the words. Because mortars hit and I froze for 3 seconds. I'm not making that choice again. My hands positioned over the fragment. This angle, this approach, one chance. This is for every patient I couldn't save. The thought came clear and cold. For Rivera, for all of them. No wasted motion, no hesitation. The training took over completely. My conscious mind stepped back and let muscle memory drive. Microforceps. Angle of approach 30 degrees. Pressure point 2 millimeters superior to fragment. Follow the arterial wall. Don't penetrate. Don't slip. The fragment was visible. Right there. Pressed against the coronary artery like a loaded gun. I exhaled slowly. Inserted the forceps. Found purchase on the fragment's edge. Steady pressure, rotating. Following the tissue plane between fragment and artery wall. The fragment shifted. 0.1 millimeters. 0.2. 0.3. It came free, clean, perfect, no arterial damage, no bleeding. The fragment dropped into the specimen tray with the others. 3 down, all clear. The monitors showed immediate response. Vitals stabilizing, heart rate strong, blood pressure normalizing, bleeding controlled. He's stable. The anesthesiologist's voice cracked slightly, disbelief and relief mixing. He's actually stable. The OR erupted in quiet murmurs, celebration restrained by professionalism, but the energy was unmistakable. They'd witnessed something extraordinary. I said nothing, just began closing the surgical site. Sutures, precise, professional. The job wasn't done until it was done. 23:41 hours. Whitmore removed his mask. His face was flushed, eyes bright. "I owe you an apology." "We all do." He gestured at the surgical field, at the 3 fragments in their tray. "That was the most extraordinary surgical procedure I've witnessed in 25 years. I nodded once. Kept suturing. Focused. The OR doors opened. The administrator entered, tablet clutched against her chest. Behind her, the Pentagon liaison, Captain Reeves. Her voice was different now, respectful, uncertain. "The Pentagon wants to speak with you." I finished another suture before responding. "Tell them Captain Reeves died in Kandahar." My voice was quiet but firm. "I'm just Morgan now." The liaison stepped forward. "Ma'am, we've been looking for..." "Not interested." I cut him off, moved to the next suture. "I'm exactly where I need to be." Whitmore caught my eye across the table, small nod. Understanding, the administrator and liaison retreated. The gallery emptied. The surgical team continued their work. Professional, efficient. I placed the final suture, checked the closure, perfect, clean. He'd heal well. As I stepped back, the colonel's eyes opened. Barely. Just slits. But focused, aware. He looked directly at me. Through the anesthesia, through the pain medication, seeing clearly. "I know who you are." His whisper was barely audible. I froze. "And I know why you were really at Walter Reed that day." "What?" The word escaped before I could stop it. His eyes held mine. Intense, urgent. This wasn't a random infection. Each word took effort. Someone wanted me dead, and they knew that fragment was there. The monitors beeped steadily. The room suddenly felt colder. The fragments, they weren't missed accidentally. His breathing was labored but determined. They were left deliberately. My mind raced. 3 fragments, all mobile, all positioned to kill him, slowly. Make it look like post-surgical complications. You were investigating something. I leaned closer. "What did you find?" His eyes closed, opened again, struggling to stay conscious. Medical fraud, his voice fading. 17 other veterans, all with fragments, all dying. He gripped my hand weakly. "You have to find them." Before he could say more, the anesthesia pulled him under. His hand went limp in mine, but his words echoed in the silence. 17 others, all dying, all with fragments no one else could see. I looked down at the 3 pieces of metal in the specimen tray. Not accidents, weapons, and someone had placed them there deliberately. The investigation had just begun, and I was already in too deep to walk away. 48 hours later, I stood outside Colonel Chen's private room. Pentagon security flanked the door. Dark suits, earpieces, eyes that tracked every movement in the hallway. They nodded as I approached. One opened the door. I'd traded my scrubs for civilian clothes, jeans, simple shirt, no rank, no uniform, no identity beyond the person I'd chosen to become, or tried to become. Chen was awake, sitting up. Color had returned to his face. Monitors showed strong vitals, clean recovery. He smiled when he saw me. "You came." I pulled a chair close to his bed. "You said 17 others." His smile faded. "Straight to business." "I like that." He shifted, wincing slightly. His hand went to his chest where my sutures held. The Walter Reed case wasn't an accident. Someone planted the infection to cover the fragments. "Why?" "They wanted me to die in a routine complication." He reached for the water cup. I took it too long. His voice was bitter. "I was investigating military medical fraud, surgical teams at 5 different facilities, records altered, procedures deliberately botched, and patients dying from complications that should never happen. The fragments, left behind as assassination methods, slow, untraceable." He met my eyes. "You didn't just save my life. You exposed a systematic cover-up." My chest tightened. How many? 17 veterans with mysterious post-surgery complications, all connected to my fraud investigation, all treated at facilities where records were altered. He leaned forward. All dying from fragments no one else could find. All while I'd been hiding. All while I'd been checking bedpans and avoiding responsibility. All while corruption had continued unchecked. The door opened. Pentagon officials entered, 3 of them. The lead was a woman, 2 stars on her uniform, general's insignia, Captain Reeves. Her voice was firm but not unkind. "I'm General Patricia Santos. We've been looking for you." I stood. Instinct. Military bearing I'd tried to forget. "I'm not Captain Reeves anymore." Santos studied me. "Then what are you?" "Just Morgan." She exchanged glances with her colleagues. Just Morgan performed the most complex cardiac extraction I've seen documented in 20 years. Just Morgan exposed a conspiracy that's been killing veterans for 18 months. I said nothing. "We need you to examine those 17 cases." Santos stepped closer. "You're the only surgeon with combat experience and investigative training who can spot what others miss." The words hung between us. An offer, a demand, a choice. What if I freeze? The fear came unbidden. What if another patient dies? Chen's voice cut through. "You didn't freeze when I needed you." I looked at him, at the surgical site healing under his gown, at the life I'd saved. Rivera would want you to save the others. Chen's eyes were steady, certain. He'd want you to finish what you started. Rivera, 27 years old, dead on my table because I'd frozen for 3 seconds. But Chen was alive because I hadn't. Maybe that was the difference. Maybe I'd learned. Maybe the failure had taught me something I couldn't have learned any other way. I'll do it. My voice was steady, but on my terms. Santos raised an eyebrow. Which are? No rank, no uniform. I'm not returning as a military officer. I'm coming back as a civilian consultant, special investigator status. I'll work the cases, train others to spot fraud. But I do this my way. The room was silent. Santos considered, calculated, weighed options, agreed. You'll have full autonomy. She extended her hand. Welcome back. I shook it. Not back, forward. There's a difference. 2 days later, the hospital board meeting convened. Whitmore stood at the front of the conference room. Behind him, a presentation screen showed surgical imagery, success rates, protocol comparisons. She saved a patient our entire system failed. His voice carried conviction. She identified what Walter Reed missed. She performed a procedure I couldn't have done, and she did it with 6 months of deliberately hiding her abilities. The board members exchanged glances, uncertain, concerned about protocol breaches, liability, risk. The administrator stood, the same one who'd questioned me, who'd demanded answers, who'd watched through the observation gallery. Her voice was different now. Our hospital has the privilege of hosting the most skilled trauma surgeon in the country. She gestured to where I sat in the back row. And I propose we make that arrangement permanent. Murmurs around the table. Trauma surgery consultant. Split role between our facility and Pentagon investigations. She'll train our staff to see what we miss, implement new protocols, establish a veterans post-surgical review board. I met her eyes across the room. Small nod. Understanding passing between us. From nervous rookie to celebrated expert, full circle. The vote was unanimous. Within weeks, the changes cascaded. Combat surgical cross-training program established. Veterans receiving comprehensive post-operative screenings. My methods documented, shared, spreading. 3 other hospitals adopted the protocols within a month. More inquiring. The quiet one had found her voice, and it was changing everything. 6 months later, the surgical theater was full. Residents crowded around the observation gallery, eager, attentive, hungry to learn. I stood at the teaching table, display screen showing complex imaging, a case study, real patient, real stakes. Look deeper. My voice carried to every corner of the room. Trust your instincts. Challenge assumptions. Don't accept the obvious answer when something doesn't fit. The residents took notes, asked questions, engaged. This wasn't just about surgery. It was about seeing, really seeing. The way I'd learned to see in Kandahar. The way combat had taught me that details mattered. That lives depended on paying attention. The Pentagon investigation had concluded last month. 14 of 17 veterans saved, 3 lost before I could reach them. Military medical fraud ring exposed, 12 prosecutions, systemic reform initiated, 3 still dead, 3 I couldn't save, but 14 alive, 14 families whole, 14 futures restored. I'd learned to live with that math, the grief and the gratitude existing side by side. After class, I found Colonel Chen waiting in the hallway. He walked without assistance now, fully recovered, strong. He wasn't alone. 3 people with him, his family. These are my kids. His voice thick with emotion. They exist because you didn't give up. His daughter stepped forward, maybe 10 years old, eyes bright. Dad says you're a hero. I knelt to her level. I'm just someone who learned to trust her hands again. She hugged me, quick, fierce. Then stepped back. Chen gripped my shoulder. Thank you. For everything. I nodded, unable to speak past the tightness in my throat. They left. And I stood alone in the hallway for a moment, breathing, feeling the weight of what I'd almost lost, what I'd found again. The OR called, another case, another patient, another chance. I scrubbed in, donned the gown, the gloves, the familiar ritual. My hands were steady, my mind clear, my purpose certain. They'd called me the quiet one, the nervous one, the one who didn't belong in trauma cases. They didn't know who I was. But now I did. Surgeon, investigator, teacher, protector. Not Captain Reeves, not the rookie nurse. Something new, something forged in failure and redeemed through purpose. Just Morgan. And that was enough. The patient was prepped, the team ready, the monitors establishing their steady rhythm. I positioned my hands over the surgical field. No hesitation, no fear, no doubt. This was where I belonged. This was who I'd always been. The hiding was over, the running done. I made the first incision, clean, precise, perfect. And I was never hiding again. Not from my past, not from my abilities, not from the person I was meant to be. The surgery progressed, complex, challenging, exactly what I'd trained for. My hands moved with certainty, with skill, with the knowledge that came from experience in pain and growth. Rivera would be proud. Chen was alive. 14 veterans saved, protocols spreading, lives changing. The math was better. Now, not perfect, never perfect, but better. And better was enough. The monitors beeped, steady, strong, the rhythm of life continuing, because I'd chosen to show up, to try, to trust myself again, because hiding wasn't protection. It was just another form of dying, and I'd decided to live, fully, completely, without apology. The surgery concluded. Success, another life saved, another family kept whole. I stepped back from the table, removed my gloves, my gown. The team congratulated each other. Professional, efficient, but the energy was unmistakable. They'd learned, they'd grown, they'd witnessed excellence and absorbed it. That was the real legacy. Not just the patients I saved, but the surgeons I trained, the protocols I established, the change I'd catalyzed. Rivera's family had established a fellowship in trauma surgery, in his honor, in his memory. I was the first recipient. His death had meaning now, purpose. It had led to this, to all of this. The pain didn't disappear, the guilt didn't vanish, but it had transformed into something useful, something that drove me forward instead of holding me back. I walked out of the OR into the bright hallway. The hospital hummed with activity, lives being saved, futures being written, hope being restored. And I was part of it again, not hiding, not running, not pretending to be less than I was, just being exactly who I'd always been meant to be. Morgan's protocols are now standard in 47 hospitals nationwide. The Pentagon investigation led to complete military medical system reform. She continues to train the next generation of combat surgeons. And somewhere, in a quiet cemetery, Lieutenant James Rivera rests, knowing his death wasn't in vain. That the surgeon who couldn't save him learned to save countless others. That 3 seconds of failure had led to years of success. That hiding had given way to healing, and that the nervous rookie had always been a warrior. She just needed to remember.